This is a routine phaco surgery where I will be demonstrating the stop and shop method. So after placing my keratome incision and two side port incisions, I go ahead and place some HPMC within the anti-edge chamber and then perform a 5.5 millimeter rhexis with my bent 26 gauge needle as a cystitome. Just make sure you hold the underside of the flap when you are doing the rhexis and keep coming back to almost where the flap is attached and tug on it to then go in a circular fashion and create your ideal rhexis. Once done, I do the hydrodissection, watch the fluid wave as it sweeps across, decompress the nucleus and maybe do in one or two other quadrants if necessary. I even rotate the nucleus with the tip of my hydrodissection cannula. And now I have taken a Sinski hook in my left hand and my phaco in the right, and I am going to be doing the stop and shop method. So initially I will create a central trench. The vacuum is just about 100, the flow rate is 18, the phaco power is linear, it's about set for 50%, but using far less power. As you know, this is a soft cataract, and these cataracts can be dangerous, by the way, as you will see in the video. So I just rotate it across onto its almost 180 degrees, and trench from the other side as well, making sure I have a deep enough trench, and watch how I crack it. That's it. I go to the periphery of my trench and using my Sinski hook and the phaco tip, I go to the bottom of the trench and separate. And now I am in phaco 2 where my vacuum is 400, flow rate is 40, and see how it's making holes because of this vacuum. So I just get it out, and it in fact fractures on itself. And you have to, it's very easy to phaco this. I am using very low power, 400 millimeters of vacuum and 40 ml of flow rate, and you can see the fallibility is good, holdability is good, and it emulsifies very fast. Again, it fractures on itself. I don't even fracture it, and there you go, it's over. And for the cortex, I use my bimanual, and here I have stepped down the parameters on my machine. I just use about 300 vacuum and around 20 ml flow rate, sometimes even less, and this suits me fine. You have to get the sweet spot in your machine, and you can see a bit of a small posterior capsular thickening, and I go into my capsular polishing mode, which is just 10 mm vacuum or 5 mm vacuum and 5 ml flow rate, and polish it. And after putting HPMC into the chamber, I am now injecting my single piece IOL into the bag. Yes, this has tilted a bit. You can just use your dialers to get it back into position. Put in the leading haptic first, and then just tuck the trailing haptic into the bag and do a thorough wash up of the HPMC with your bimanual or with a Simcoe or coaxial, whatever you're comfortable with. But the final end point is that you have to evacuate most of this HPMC, if not all. Conclude by hydrating my wounds and injecting an intracameral antibiotic. Thank you for watching the video.